Welcome to the JADA System hands-on demo video.
Hello, my name is Tracy, and I am here with my colleague Eleni from Organon. We're clinical educators for the JADA System. The JADA System is a medical device that is intended to provide control and treatment of abnormal postpartum uterine bleeding or hemorrhage when conservative management is warranted. We're going to demonstrate the setup and the use of the JADA System. JADA comes sealed in a rectangular green box. It also includes 12 feet of vacuum tubing and a sterile, luer-tapered 60 milliliter syringe.
You will need to gather sterile fluids such as saline, lactated ringers, or sterile water prior to setting up JADA. JADA is made from medical-grade silicone. At the distal end, there's an intrauterine loop with 20 vacuum pores that are designed to suction pooled blood from inside the uterus. The loop is covered by a soft silicone shield designed to protect the intrauterine tissue during treatment. The cervical seal will be placed in the vagina at the external cervical os and inflated with up to 120 milliliters of sterile fluid. At the proximal end of the device, there is a seal valve for filling the cervical seal with sterile fluid. There's also a vacuum connector to connect the vacuum tubing to regulated wall suction.
Prior to inserting JADA, you need to evaluate for lacerations, retained products of conception, and other causes of bleeding, and remove any organized clots. Ensure the bladder is empty to facilitate palpation and contraction of the uterus. Next, connect a vacuum canister and 12 feet of standard vacuum tubing to a regulated vacuum source. With the end of the tubing occluded, set the regulated vacuum source to 80 millimeters of mercury plus or minus 10 millimeters of mercury.
Use the syringe to remove air from the cervical seal prior to inserting JADA. Then grasp and compress the intrauterine loop and insert transvaginally by hand. If needed, you may use gentle traction on the anterior cervical lift to stabilize the cervical opening. Do not grasp JADA with an instrument to facilitate insertion. Next, ensure correct placement of JADA with the intrauterine loop within the uterus and the cervical seal at the external cervical os. The seal valve should be oriented at either 3 or 9 o'clock. Fill the cervical seal with between 60 and 120 milliliters of sterile fluid. It is important that you do not advance the cervical seal into the uterus while filling JADA. Confirm the cervical seal is within the vagina and outside the external cervical os. Connect JADA to the vacuum tubing. Leave JADA in place with the vacuum applied, using tape to secure the tube to the patient's inner thigh. Blood flow into the vacuum tubing and/or improvement in uterine tone should be observed after initiation of the vacuum. After initial evacuation of any pooled blood, presentation may vary during treatment. There may be no further blood evacuated or additional blood moving into the tubing or accumulation of blood in the canister. In the Pearl study, uterine collapse was observed within a median time of 1 minute and bleeding controlled within a median time of 3 minutes. Verify bleeding is controlled and then leave the vacuum on for at least 1 hour. Next, verify the uterus is firm and the patient is stable before disconnecting the vacuum. Ensure the tube remains secured with tape to the patient's inner thigh. Disconnect the vacuum tubing from JADA while the vacuum is still on to collect any blood from the tubing into the vacuum canister. Next, remove all sterile fluid from the cervical seal and leave JADA in place for at least 30 minutes to verify bleeding is controlled. If bleeding remains controlled and the uterus remains firm, remove JADA slowly while supporting the uterine fundus. In the Pearl study, the pivotal clinical study for JADA, the median time of vacuum treatment was 2 hours and 24 minutes, and total indwelling time was 3 hours and 11 minutes. Consider prophylactic antibiotics for prolonged use and do not leave the JADA in place for greater than 24 hours. Thank you for watching the JADA System hands-on demo video. you.